Kia ora everyone. I thought I would jump online this evening just in the wake of some of the news that everyone would have heard today with our latest COVID update, just to share a bit of additional information and also give everyone an update on some of the action that has been taken since the news you would have heard this afternoon. First of all, just a little bit of context. We, of course, have been very open about the fact that in an environment where we continue to see COVID cases globally and those cases growing, that there was unfortunately always an expectation that given New Zealanders can still come into New Zealand, albeit entering isolation facilities, that we did expect that we would see cases coming into those isolation facilities. Having said that, the two cases that we've had come in from overseas that were announced today were not announced under the circumstances that we would have expected at our border. And we should be utterly clear on that. Those circumstances we do not consider acceptable. That's off the back of the information that many of you will have heard, that in these two cases, which of course were both family members and together, we should be clear on that, compassionate leave was granted for those individuals. However, the testing of those individuals was done at outside of their isolation facility. That does not meet our expectations, and I know it will not meet your expectations either. A couple of things, however, to keep in mind. While, of course, we are reviewing exactly what has happened in these circumstances because they cannot be repeated, we have also, the Minister of Health, directed the Director General of Health to suspend all compassionate leave. Many of you will have heard that we've had a number of cases at our border where people have been in quarantine, where they have sought to have leave because they have, for instance, a family member who might be in a situation on their deathbed or so on. And those circumstances, that's when people have made applications. They've never been treated as though they are risk-free. There's always been circumstances and criteria around those individuals. You might recall we denied so many that in one case we were taken to court over it. However, the requirements put around in this case, or the checks and balances in this case, were not adequate. No question. And so the compassionate leave has been suspended. The Minister of Health has directed the Director General of Health to do that because it has not met our expectations or indeed yours. And so that will not be happening until such time or unless we can ensure that it is much, much, much more rigorous. Ultimately, after taking a look at what has happened here, there is already an expectation that no one leaves quarantine until they have completed their 2 weeks and been tested. Of course, that was our expectation already, so that is where there is a failure in this case. Again, I do want to highlight to people, we do not have open borders. New Zealanders who are returning home, and this is one of the reasons we've had so many complaints, in fact, about the number of people who are wanting to come into New Zealand but have been denied the ability to, is because we do not have open borders. The only people who can come in are New Zealand citizens or permanent residents, and when they do, they are taken straight to a monitored facility. And so that has not changed. What has happened here is individuals have been granted compassionate leave under circumstances that it is quite clear they should not have been. So that is what has occurred. That is something that we have taken incredibly seriously. You can imagine our response to this news, and you can imagine the action we're taking as a result. So that's just the update that I wanted to share with you today, and just give you that reassurance that this is something that we take incredibly seriously. And again, as I say, we have been so stringent on this in the past that we've been challenged in the courts over the fact that we have denied people the ability in some very devastating circumstances to be with their family. I'll provide another update, again, as I say, for At this present point in time, this compassionate leave is suspended. And of course that expectation that we've put in place that no one leave their quarantine until they've fulfilled those 14 days and being tested. Those extra reassurances are in place, but that will not be the end of the work that we are doing. Because of course this is the most risky, this is the biggest risk that we continue to have is our border, and we've always of course been very clear on that's why it was so important to have those protections in place. I have a couple of questions I see streaming through which aren't quite accurate in the question, and sort of no fault, of course, there's lots of information out there, but one thing I just wanted to highlight again is that some of the exemptions that are being provided at the moment for people to come into New Zealand, you will have heard these economic exemptions, do not mean people are exempt from quarantine. They are not. So people who are coming in for economic reasons because they're considered a crucial member of a workforce and that hundreds of jobs will be lost without them, they are not exempted from being quarantined. They are put into managed isolation just like everyone else. And that is because it is incredibly important that we make sure those protections are in place. Some of the questions that I see coming through about why compassionate leave existed in the first place. Again, people will actually have heard that this, and there's been a lot of pressure actually in the system all the way through, people who come into New Zealand who are in quarantine, who ask for specific reasons to go and visit perhaps a loved one who might be dying. No one is ever treated as if they are safe under those circumstances, but there have been circumstances under which very tight protocols have been worked in to allow people to see a dying relative. So that has been part of the system in the past. We've always had an expectation that there were very rigorous protocols, and as I said at the beginning, in this case it's clear our expectations around those rigorous protocols have not been met in these circumstances. Again, to just quickly though finish, I think it is really important to point out that even though those expectations have not been met, what has been reported to us is that these individuals have not had contact with wider members of the public. They have been in isolation. They've been in contact with one other family member. Rigorous testing is now taking place across, as you can imagine, across those who were in quarantine facilities at the same time and those who may had even the remotest chance of contact. So you'll see us keep giving updates around some of that rigorous testing that is taking place. Again, update for now. You'll expect to hear more from us on this particular situation, and rest assured that we are doing exactly what you would expect in response to this news and information. In the meantime, thank you everyone for joining me on this quick update. I'll look to jump online again sometime later in the week to give you a bit more information as we work through some of these issues. And I'll try and skim through some of the questions that you're leaving with me to make sure I try and cover them off as well. All right, everyone. Thank you again for tuning in, and let's be in touch again sometime soon. Look after yourselves.